Hello and welcome. My name is Megan Meganson. I am a certified sex therapist and founder of the Center for Couples and Sex Therapy here in Portland, Oregon. We've received many questions from our clients about how to practice safe sex during this pandemic. And honestly, we weren't sure exactly how to respond. So we've done some research, and my colleague and fellow therapist, Alexis Fitch, is here to share with you what she learned about sex and the COVID-19 coronavirus. Please remember, we are not doctors, and if you have any questions about this information or your sexual health in general, please contact your physician. In the meantime, we really hope this information sheds a little bit of light on the topic of sex and the pandemic. On that note, I will pass the torch over to my colleague, Alexis.
Thank you, Megan. Again, my name is
Welcome.
Alexis. I'm a resident therapist at the Center for Couples and Sex Therapy. And as Megan said, we have received a lot of questions around how to have sex, what can be the safer ways to have sex during this pandemic. So these are just guidelines on how to have safer sex. Again, we are not doctors, so just take this and use it as you will. And again, any other questions or concerns, please contact your primary physician or doctor. So the basics are what we should know about sex and how it is being impacted by COVID-19. The first thing that we know is that COVID-19 can spread through saliva and mucus, aka if you're kissing, that's an easy spread on how COVID can be spread by partner to partner. The second thing we do know about COVID-19 is that it has not been found in semen or vaginal fluid. Another thing that we should note too is other forms of coronavirus have not been shown to spread through sex. So this is another important thing to know about this. And the last thing we know is that COVID-19 has been found in feces of people infected with the virus. So that's another important thing to know in terms of the different ways this virus is being spread through people by people and through surfaces. Another important thing to know is, okay, we know how sex is impacted by COVID-19. What do we do with this information concerning sex with others? So another thing, the safest partner besides yourself is someone you live with. With self-pleasure, COVID-19 has not been shown to be spread through masturbation, especially if you're using just a basic hygiene of washing your hands. If you're using toys, just make sure to wash them with warm water and antibacterial soap and let it air dry. So if you're using those basic practices and you're self-pleasuring with yourself, there's really no risk in COVID-19 being spread. Avoid close contact, including sex, with anyone outside your household. So if your partners live with you, this is safer in reducing the spread of COVID-19. If you do have sex with others outside of your household, I know people do have other partners besides their primary partners or nesting partners. Just make sure you have as few partners as possible. That way we can reduce the spread of COVID-19. With that being said, we want to pause online dating and hookups. There are many other options you can use in order to find other partners and then just keep connection with partners that you know you don't live with. You can use video dates, sexting, chat rooms. These are all ways to build that sexual connection and have that safer practice too, where there's no contact, but you can still build up that desire and pleasure and contact either partners you have outside the home or potential partners when quarantine and isolation is over. Now, concerning sex and during it, you want to make sure you kiss people only in your small circle of contact. So these are partners that you have in the home. If you have a partner outside the house, just make sure, again, fewer partners as possible to have direct contact with. Because as mentioned earlier in the previous slides, COVID-19 has been shown to spread through saliva. So again, kiss as few people as possible. Another activity, rimming, aka mouth on anus, might spread COVID-19. As mentioned earlier in our slides, COVID-19 has been shown to be seen in feces of people infected with COVID-19. So if you are practicing rimming, just make sure you're using safe practices and know the risks and talk to your partner about that before y'all both consent to doing this. Use condoms and dental dams. Using this can reduce contact with saliva and feces. So just using barriers when you do have sex. And the last one, again, mentioned earlier, is wash up before And after sex, this means washing your hands before having sex with your partner and after having sex with your partners, before you're going into that aftercare. If you want to cuddle or just spend time, just make sure you use that hygiene. If you use toys during your session, again, mentioned earlier, please wash those before. Again, just with antibacterial soap and warm water, let that air dry. And then after using it with your partner, wash those again. You can use condoms or any other barrier on your toys. Again, that can reduce that spread even more, just again, to make sure to keep washing those and let those air dry. So again, we just wanna practice hygiene and making sure everything's clean before we have sex and then after having sex too. Another important thing to know is when to not have sex with your partner. So if you or your partner have COVID-19, again, that's just no sex. You can always, again, do that video chat, sexting, but any physical contact, we just want to pause for a moment until our partners are quarantined, they're feeling well, and then we can regroup and get that physical contact. But for right now, if you are infected with COVID-19, just pause sex for a moment and use other pleasure contact for them. If you or your partner is just feeling unwell in general, we want to err on the safer side and just not have sex. See how your partner is feeling, any symptoms, talk to your doctor or any primary physician, weigh out the symptoms of it. Again, you can always use other pleasure activities, either sexting or phone chatting or just video chatting, and then just weigh out the symptoms, see if everyone's feeling well before having sex. And the last one, when you should not have sex, is if you or your partners have a medical condition that can lead to more severe COVID-19. There has been some symptoms or medical conditions that influence how COVID-19 is spread throughout the body. So just make sure you have a medical history of you and your partner, weigh the pros and cons, be very risk aware, and see if you're feeling safe or your partner feels safe to have sex. And just have that information before y'all both consent. And just having all that information in mind can make you feel a little bit more comfortable in having sex. Again, there's no 100% safe way to have sex during COVID-19. However, there are safer ways to have sex, and be very risk aware before having physical contact with your partners. And that's really it for that one.
Alexis, thank you so much
Yeah.
for sharing this information. It's great just to know, when are we vulnerable?
Mm-hmm.
What should we be doing proactively to prevent the spread of this virus?
Right.
As I'm listening to your information, it feels to me like the most challenging part of
Mm-hmm.
the pandemic and sex is simply not being able to have sex if
Right.
our sexual partners don't live with us.
Right.
So it's such a hard point, right? Trying to balance social distancing and minimizing the spread of the virus with also making sure that my needs are being met, my
Right.
sexual needs, but also emotional needs,
Right.
for hugging and, face-to-face contact. So I really appreciate your suggestions about other ways to meet
Mm-hmm.
sexual needs during this time.
Right.
Obviously, like masturbation is always a safe way to have sex, but chat rooms, texting, sexting, video calls, like we just have to get creative right now to keep everyone safe.
Right.
Are there any other ideas or suggestions you have, Alexis, about what people can do if they are alone, isolated, and I don't know, needing, feeling or not having their needs met? Just any other thoughts you have?
Yeah, it's important to, if you have partners, or even if you don't have partners, but you have that close contact, just being very vulnerable in that moment, because you won't be the only one feeling this way. So sharing that vulnerability and just stating how hard this is can really help. Just having that close contact, either through that video chat so you can see your partners or a close circle space, just to have that sense of almost connection or physical closeness. So again, just being vulnerable and sharing time with a partner. There's been a lot of circles or like parties online that's happening. A lot of people are doing like Instagram lives or Zoom parties or just anything to help form that connection. If you don't have a close circle like that, just have that connection with strangers that can become closer too. Yeah.
Yeah, thanks for those reminders.
Yeah.
So it twofold. If you do have a partner who doesn't live at home with you, it
Mhm.
sounds like you're recommending really being vulnerable with them
Yeah.
about the struggles that you're having, how hard
Mhm.
this feels.
Yeah.
Um, and if maybe you're not partnered or you don't have someone you feel comfortable calling up and being really
Mhm.
vulnerable with, finding larger groups to connect
Yeah.
with, like Zoom parties, or
Mhm.
just making sure you're staying connected with other people in
Yeah.
general.
Yeah.
I'm going to add in,
Mhm.
just since it's, you and I are still seeing our own
Right.
therapy clients in our virtual therapy offices.
Mhm.
So I'd love to just remind people as well that, therapy is available to you.
Mhm.
We're here at the Center for Couples and Sex Therapy. But if you're not in Oregon, or, you need a therapist with a different type of specialty, most providers have transitioned
Mhm.
to telehealth, online therapy, just like this.
Mhm.
So don't suffer alone. Don't suffer in silence. If you don't have a partner you can connect with, if you don't have a social group that's accessible to you right now, make sure you're getting the support you need with a qualified mental health provider.
Mhm.
Would you agree, Alexis?
Yes, absolutely. A lot of agencies or even private practices are switching to telehealth just to reach out to more people and have that
Yeah.
connection. A lot of people are doing reducing their fees or doing sliding scales because we realize how important like sharing and having these connections can be.
Yeah, totally. Okay, this was really helpful. We encourage you to visit our website. We have recorded other webinars right now about pleasure, mental health, anxiety, relationships. So we're doing our best to share everything we know with whoever needs it right now to make it through this really unusual and stressful time we're experiencing. Our website is www.ccstpdx.com. And we hope you enjoyed this video. Thank you again, Alexis.
Yeah, thank you.